Good day. We are from Blog NF and we are presenting cystic fibrosis. By definition, cystic fibrosis is an autosomal recessive disorder that affects a protein in the body which greatly affects the body's cells, tissue, and the glands that make mucus and sweat. Autosomal recessive disorder are the disease caused by a mutation of a gene. Predisposing factors of cystic fibrosis, also known as risk factors, includes family history of the disease, race, and ethnicity. The country with the highest rate of babies born with cystic fibrosis is Ireland, in which 1 of every 1,353 newborns are affected. The only risk factor for getting cystic fibrosis is having 2 parents who carry abnormal CFTR genes. That said, there are really no identified other than precipitating factors or those factors associated with a definitive onset of cystic fibrosis. However, there are things that influence the severity and progression of the disease. First, poor nutritional state. According to the University of Wisconsin research, poor growth is the factor most strongly associated with severe cystic fibrosis lung disease. As a result, people with cystic fibrosis must ingest a very large number of calories to maintain weight and growth, which is often difficult if there is a serious intestinal involvement. Second, undertreatment with antibiotics is another significant risk factor. Undertreatment can raise the risk of infection, while inconsistent antibiotic use over time can lead to resistance, limiting future treatment options. Third, infection with Pseudomonas aeruginosa, a bacterium typically acquired by a person who have been in the hospital for more than a week. Fourth, secondhand smoke raises your risk of illnesses and problems nearly as much as smoking does.
For the etiology of cystic fibrosis, it is a genetic disorder associated with mutations in the cystic fibrosis transmembrane conductance regulator or CFTR gene. The information for the CFTR protein are provided by the CFTR gene. However, because of abnormalities in the CFTR gene, the CFTR protein does not operate effectively. This results in thick, sticky mucus and clogs in the lungs and digestive tract. Not all CFTR mutations are created equal. Depending on the source, mutations are divided into 6 classes as follows. Class 1. The mutation results in the production of few or no CFTR. Class 2. The mutation causes CFTR to be deformed and non-functional. Class 3. The mutation causes a gating defect to where CFTR blocks the movement of water and salt in and out of cells. Class 4. The mutation causes a conductance defect to where CFTR restricts the movement of salt in and out of cells. Class 5. The mutation decreases the production of CFTR protein. And Class 6. The mutation results in functional and unstable CFTR that needs to be constantly replaced. Classes 1, 2, and 3 will result in the most severe classic symptoms of cystic fibrosis, while classes 4, 5, and 6 are milder by comparison.
Let us talk about the disease process. Since it is a genetic disease, it cannot be passed on from one person to another, unless inherited. Therefore, it is possible to be a carrier without contracting the disease themselves. The CFTR protein is responsible for regulating the proper flow of chloride and sodium in and out of the cell membranes in the lungs and other organs. When the CFTR protein is defective, ion transport through the cell membrane is affected, and chloride becomes trapped in the cells. Water then cannot hydrate the cellular surface because of the lack of chloride movement. Mucus becomes thick and sticky, which can no longer act as lubricants, but instead plug up tubes, ducts, and passageways in airways, glands, and the digestive tract. This can actually cause problems, especially in the lungs and pancreas. Respiratory complications are due to the faulty mucus production in the respiratory system. There is no normal flow of salt and water in and out of the cells in the lungs and other organs, and a breeding ground for bacteria and viruses is developed. As lung function decreases, other vital organs in the body are unable to receive enough oxygen, which puts a strain on the heart and lungs, possibly leading to a respiratory and heart failure. CF also affects the pancreas, which damages the organs and impairs its ability to produce insulin and digestive enzymes, which may lead to certain digestive symptoms. The shortage of insulin from the pancreas can also result in what we call as cystic fibrosis-related diabetes mellitus or CFRDM.
The reproductive system is also affected by this disease. Congenital bilateral absence of the vas deferens, also known as CBAVD, is a possible symptom in male with cystic fibrosis. CBAVD is a condition wherein the vas deferens is blocked by mucus and is not able to develop properly, leading to infertility unless they undergo fertility treatment. Women may also have an increase in thick cervical mucus that may lead to decrease in fertility, but many women with cystic fibrosis are still able to have children. Aside from the body system that cystic fibrosis affects, it also leads to excessive amounts of salt lost in sweat, considering the ineffective ion movement of chloride outside of the cell membrane. This can upset the balance of minerals in blood, which leads to electrolyte imbalance and dehydration, especially during exercise in hot weather. This would require additional nutritional needs and include risks like abnormal heart rhythm, fatigue, weakness, and low blood pressure.
The following are the nursing diagnoses for cystic fibrosis. The major nursing diagnoses for cystic fibrosis are ineffective airway clearance related to thick tenacious mucus production, ineffective breathing pattern related to tracheobronchial obstruction, risk for infection related to bacterial growth medium provided by pulmonary mucus and impaired body defenses, imbalanced nutrition, less than body requirements related to impaired absorption of nutrients, anxiety related to hospitalization, compromised family coping related to child's chronic illness and its demands on caregivers, and deficient knowledge of the caregiver related to illness, treatment, and home care.
Like mentioned, the thick and sticky mucus associated with cystic fibrosis clogs the tubes that carry air in and out of your lungs. This can cause signs and symptoms such as persistent cough that produces thick mucus or sputum, wheezing, exercise intolerance, repeated lung infections, inflamed nasal passages or a stuffy nose, and recurrent sinusitis. Furthermore, the thick mucus can also block tubes that carry digestive enzymes from your pancreas to your small intestine. Without these digestive enzymes, your intestines aren't able to completely absorb the nutrients in the food you eat. The result is often foul-smelling greasy stools, poor weight gain and growth, intestinal blockage particularly in newborns, chronic or severe constipation, which may include frequent straining while trying to pass stool, eventually causing part of the rectum to protrude outside the anus or rectal prolapse. As a result, treatment and follow-up care is recommended. Further management include: first, diet. In general, a normal diet with additional energy and unrestricted fat intake is recommended to compensate for malabsorption and the increased energy demand for chronic inflammation. Second, exercise. Regular exercise increases physical fitness in patients with cystic fibrosis. Upper body exercises such as canoe paddling may increase respiratory muscle endurance. Third, monitoring. Patients are monitored in the CF clinic every 2 to 3 months to achieve maintenance of growth and development, maintenance of as nearly normal lung function as possible, intervention and retardation of the progression of lung disease, clinical assessment to monitor gastrointestinal tract involvement, and monitoring for complications and their treatment. Lastly, vaccines. Routine vaccinations are indicated in patients with cystic fibrosis, including seasonal influenza vaccination. Pharmacologically, we manage the disease by providing pancreatic enzymes, vitamins, bronchodilators, mucolytic cystic fibrosis, transmembrane conductin regulator, or CFTR, and antibiotics. For the healthcare management, as nurses, we intervene by improving airway clearance, improving breathing, preventing infection, maintaining an adequate nutrition, reducing the child's anxiety, and providing family support.
The diagnosis of cystic fibrosis, or CF, is based on typical pulmonary manifestations, gastrointestinal tract manifestations, a family history, and positive sweat test results. First, screening and prevention. Genetic testing may be performed to look for carriers as well as to screen relatives of people who have cystic fibrosis. Genetic testing may also be used as prenatal screening tool to look for a mutated CFTR gene. Sweat chloride test. The sweat test measures the amount of chloride in sweat. Kids with cystic fibrosis can have 2 to 5 times the normal amount of chloride in their sweat. In the sweat test, the skin is stimulated to produce enough sweat to be absorbed into a special collector and then analyzed. Lastly, genotyping, or the process of determining differences in the genetic makeup of an individual by examining the individual's DNA sequence.